You're live.
Oh, good. So this is Senate Health and Welfare. It's May 30th, and we're looking at draft 4.1 of a resolution that was referred to us as a bill. It's offered by Senators Gulick and Lyons. And Jen, if you don't mind going through it one more time with us, please. I know we've looked at it at least 3 or 4 times.
Yes, sure. Jen Carvey, Office of Legislative Counsel. This is on your website. It's marked as draft 4.1, I think, and now it is SR 16. So this is a Senate resolution opposing recent federal actions that threaten public health and urging their swift reversal. So as a number of whereas clauses, whereas on January 20th, 2025, President Donald J. Trump issued an executive order to withdraw the United States from the World Health Organization, a move that jeopardizes the health and well-being of Vermonters, other Americans, and individuals all around the world because of the WHO's focus on improving public health and on detecting, preventing, and responding to health emergencies, including disease outbreaks that do not respect state lines or international borders.
So should we stop after each whereas?
Yeah, let's do that.
Okay. Are there any questions or comments?
I have a comment on that. A lot of the European countries have withdrawn from the World Health Order as well.
Which ones?
Britain is one of them. They withdraw, I read the article on it, that they withdrew from. I know Britain is one of them.
That's okay. I mean, so this only indicates that we've withdrawn. It doesn't say anything.
Yeah.
And it says that it does have an effect. So clearly,
Yeah, so
Yeah.
there's some of the other ones.
yeah,
over
some of the
there.
other countries are doing that as
Yeah,
well
so a lot of the other countries have withdrawn.
for purposes of
They
money.
just feel like they had too much control and they didn't want to, they wanted to take control back for their country.
Okay.
So
They didn't want to do what?
they felt that the World Health Organization had more control and they wanted to take control back to from their government. They wanted their government to take control.
According to the New England Journal of Medicine, there are 194 countries that are part of the WHO. For what that's worth. Yeah, I think for me, the important takeaway for this is that, as we know, diseases do not respect borders. And so the fact that this work on disease outbreaks is part of the WHO, and that, we are cutting funding there is incredibly dangerous, not just to folks abroad, but for people in the United States and Vermont. So
Okay.
All right, the next whereas clause, are you ready to move to that one?
Mhm.
Whereas the U.S. Department of Health and Human Services is eliminating the jobs of approximately 1,000 employees, including the Centers for Disease Control and Prevention, where teams were cut whose work focused on preventing injuries and violence from causes including motor vehicle crashes, child maltreatment, and traumatic brain injury, on tracking trends in mental health and substance use disorders, on rape prevention and education, on maternal mortality and maternal and child health, and on many other areas affecting public health in Vermont, the United States, and beyond.
Okay. Any questions there? Sort of pretty straightforward. Okay, Jen.
All right. Next, whereas the Trump administration has eliminated the entire management and regulations divisions at the Center for Tobacco Products in the Food and Drug Administration and cut most of the staff at the Office on Smoking and Health at the CDC, which severely hampers tobacco regulation and enforcement efforts and will have a negative impact on tobacco prevention in Vermont's youth and on Vermonters' public health.
Question there. Certainly the use of tobacco can cause cancer of the mouth, throat, and lungs, depending on the type of tobacco use.
That's why I only smoked one half a cigarette my whole life and never chewed tobacco.
Smart move.
I bought a pack of cigarettes, I smoked half of it and said, this is not what I want. I gave the rest of this other guy
Wow.
to smoke all the time.
Smart.
I thought this section was important just because of the work that we did last session on S18, and I know you've been working on this
Yep.
for years and years. banning flavored tobacco products. So this fit in with a lot of the work.
I
that we do
really
with
wish they
community.
could ban the state of Vermont. I wish they banned vape.
Well,
It's right full of chemicals. It's so full of chemicals that it's getting into people's
Right.
kids' lungs.
I'm gonna have a bill next session. We can work on it.
Okay, that would be a great bill. That not, so
I'll let you know. Good. Good point. All right, what's next?
Next, whereas the National Institutes of Health, a part of the U.S. Department of Health and Human Services that describes itself as the nation's medical research agency, making important discoveries that improve health and save lives, is now refusing to award grant funds to universities that operate any programs that advance or promote diversity, equity, and inclusion, which jeopardizes the future of medical research and disregards the existence of health inequities.
Yeah, I will say, we certainly took a lot of testimony during COVID about the different effects of COVID and other diseases on different groups, the diversity of groups of folks. So, yeah. We've had testimony. Wow. You want any comments there, questions? Okay.
Whereas the U.S. Department of Education cut approximately $1 billion in federal grants that support critical mental health services in schools, which will dramatically reduce access to these services and threatens the health and well-being of youth around the country.
Do we need to say any more about that?
I mean, it's kind of an epidemic that we passed cell phone free school legislation because of mental health risks. We know that mental health services are bumping up our education costs, which is a property tax issue. So it is all relevant in all the work that we've been doing.
I know the healthcare costs.
Martine, what are the nature of the federal grants that were cut?
In the,
Senator Gillick brought the House or not informed.
that's okay. That's a really good question, but I just was
Some of them
hearing
were.
this morning that Harvard is having a lot of care. Obviously, that's been in the news. But I think people are really concerned about the research that has been done, and I'm sure it's multifaceted. But I can certainly if you want some specifics, I can look at.
Some of the grants that were cut were directly to support school programs for mental health services
Yeah, they were
at the
higher.
secondary and elementary school levels.
Direct.
We did have some of those during, with the ERA funds. We had $3 million that I put in place for that. And then because of the work that was done during COVID, the grants were continued at the federal level. Now they're being cut. So that would have been AOE grants directly to our education for kids. Kind of sad they're gonna do that. But they did.
All right, and finally, whereas it appears that the Secretary of the U.S. Department of Health and Human Services lacks understanding of science and scientific research, including a peer-reviewed research regarding vaccines and autism. Goes on to the results.
Right, we heard about autism this morning in the other resolution and certainly vaccines. The concern about taking COVID vaccines away from healthy young children because they're
Right, the
healthy.
CDC,
Pregnant
there's
women.
sort of breaking news this afternoon that I think the CDC is to some extent overriding or walking back that.
Thank goodness.
It contradicted and advised they've sort of downgraded it to it's okay in consultation or shared decision making with the patient and the family and the provider. So they're not taking it off the list entirely.
So they're allowing for that discussion to take place.
It seems to be article that I read when I was upstairs. So then therefore be it resolved by the Senate that the Senate of the state of Vermont stands in support of science, opposes these federal actions and urges their swift reversal, and may it further resolve that the Secretary of the Senate be directed to send a copy of this resolution to President Donald J. Trump, Secretary of Health and Human Services Robert F. Kennedy Jr., and the Vermont congressional delegation.
So I guess they did listen to us. They were doing as proposals.
That's right.
All right. Okay, so we've got this, we've been working on this, as Jen said, we've looked at it 3 or 4 different times in here. And then it came back to us, so the resolution is, I think I would consider moving it out to the full Senate.
When did we look at this 3 or 4 times? We just got this today. It just barely got read in the Senate about 2 hours ago.
No, but we've,
The draft is a
We've
request.
had it in this committee,
It was
several
introduced,
times.
it was reviewed as a draft.
Previous drafts.
Yes, 25-9168.
As a committee,
As a committee.
and this isn't a committee resolution.
Nope, it's not.
So then this was introduced about 2 hours ago, and we looked at it for the first time right now.
No. Let me take you back. If you look at this resolution online, you will see that we have talked about it previously. And then this morning we looked at a draft and then we made a new draft. And this is the second draft we made. Then Senator Gulick took it upstairs. It was sent back to us to look at. And now we're looking at it for the 3rd or 4th time. Okay, that's how it works. That's how it goes. And this morning we looked at autism similarly, the first time, and acted on it. It is a resolution.
yeah, I mean, is there anything in particular that you want to point to that is problematic?
Do you want to make an amendment on it?
So I would be extraordinarily happy to give an amendment to the full Senate. In such a way that I'd be happy to vote for it on the floor. And I think there's a path to that. And I think there's a path to having a bipartisan vote for it
What
as well.
is it that you would like to make recommendations for the resolution today?
Well, let's, first of all, well, I guess not first of all, I need to go through the rest of it and smiling, but first of all, the last whereas, I think I don't think the secretary lacks understanding of scientific research. I think what you're driving at more is that he disregards scientific
Well,
research.
okay, it appears that the Secretary of Health lacks, what you want to say, disregards.
I think that's more, I think that's more getting to what,
I'm
You're
happy to
trying to
put
get
that in because that's probably more sensitive to the individual, so. you could
instead of
say
understanding.
Disregards, it appears you disregards. Okay,
Disregards understanding.
No.
disregards science and scientific research. I would agree with that.
Because I think he understands it perfectly well. Whether or not,
I've worked with them on water pollution issues. Oh, I say. Yeah. Anything else there? I'm good.
Is there anything else, Sam, that?
I think saying withdrawing from who a move that may jeopardize the health, equality of Vermonters. I think is more accurate than just it will jeopardize the health, well-being.
You're looking at
The first
the
whereas.
third sentence in the first
Yes, ma'am.
whereas, so it would say a move that may. I think that's. Okay,
Well, it doesn't say will, it says
Well,
jeopardizes,
that jeopardizes, I think it means the same thing as will jeopardize.
That-
I was just,
that may jeopardize.
okay,
Well,
and is it accurate that the CDC, the teams? Okay, I would assume that is probably very accurate. Teams do not keep.
yes, I think that's probably,
Is motor vehicle crashes, I suppose child maltreatment related to public health, are motor vehicle crashes related to public health? I'd say
But
that's,
there are work groups that look at preventing injuries from motor vehicle crashes by testing and as in particular, could be seatbelts, it could be other things that would prevent injury during motor vehicle crashes. Yeah, they do that.
could we instead say, go to the bottom line of that whereas and say affecting public health and strain on our hospitals in Vermont? Is motor vehicle
Well, but I
crashes
think we have to do
definitely
that
a strain on.
beginning of the sentence, so it's eliminating jobs where teams were cut whose work focused on various things, so I don't know that their work focused on areas affecting
Yeah,
strain.
I get
No, I meant at the way bottom, sorry, Jen, at the bottom of that paragraph, on many other areas affecting public health. In
including
Vermont,
hospitals.
that puts strain on our hospitals somewhere down there,
Oh, I see.
because.
That may put strain.
Okay.
I don't know if I would call like traumatic brain injuries public health. I think it has an effect on our hospitals because those people go to hospitals and are then treated in hospitals.
I think all these.
Oh, these are all.
We could say
Yeah, these are all
population
public.
health, if you
These are all
heard
public
that.
health.
Okay,
Yeah.
maybe I just don't know what public health
Yeah.
is.
Yeah,
Sorry.
I mean, you could even,
Yeah, this is definitely public health. I don't know. I think it's fine the way it reads. Public health is pretty encompassing.
I also say I'm getting back since we're wordsmithing. The very meaning of the word jeopardize. It says that you are in danger of something possibly happening. So. Yeah, so. Moving us out of the World Health Organization definitely jeopardizes.
He's on the second one.
I know, but I'm just still having an issue with
Yeah.
May, because it
I know.
actually does jeopardize. It doesn't mean we are all gonna get sick. It doesn't even mean that anyone's gonna get sick, but it jeopardizes the health and well-being of Vermonters because it puts us at risk.
Yeah, you're right. It does increase the risk.
So I don't
like.
I hear what you're saying, but I don't think that word in and of
Do you
itself.
want to take testimony on that then to see if it would?
What the word may, Jen, if you put the word may in there as a legal expert, that may jeopardize versus jeopardizes. There's a distinction.
I mean, I think one is a stronger statement, one is a
A weaker
weaker
statement.
statement. And I think I think may jeopardize is, harder to argue about. Jeopardize is taking more of a position.
More causal. I think I would go with that. I would agree with that.
Yeah, so I'm not gonna, fight that, but I mean, just the very definition of word jeopardize.
I know.
Where there's a danger or something that we forget.
Okay. Anything else here?
I disagree with the actions that the administration has taken in tobacco cessation. However, will that have a negative impact on Vermont? Vermont has a very robust anti-smoking wing within the Department of Health as it stands. And as we all know,
She's an expert on
in-state,
this.
I am aware, in-state actions affect in-state residents more than federal actions tend to do. But we all know that, like, what we do here in this building affects Vermonters more than the federal government.
So I will note that the federal government largely regulates tobacco. We are preempted from a lot of tobacco regulations, so without federal people regulating it, the state would be preempted from coming in where they have not
Right.
around the safety of products, the compliance of products.
Thank you. Okay,
My question for you will be,
can we get a clean copy of this?
well, right, do you want this as a strike all? I'm assuming,
If, it depends, if we had a clean copy, strike all, then, my question would be, would you be interested in supporting this as a committee? I think that would be the interest with the changes that we just made, may jeopardize, and then, disregards rather than lacks understanding to the board. So who would be in favor of supporting the proposal as a committee resolution with those two changes?
I have questions.
Yeah.
On the CDC one again,
Mhm.
uh. So those teams that were cut, is that comprise the entirety of the 20,000 employees? Were there other employees that were cut, part of those 20,000 that were not just working on those things? There's more.
Those are just a,
So again,
A smattering.
Yeah.
Yeah, I mean, my sense, having just done some reading on all of this, is that it's evolving. And we actually don't know what all the consequences, obviously, of this will be. But that it certainly, it sort of sets the stage for negative outcomes and health impacts. And all the things that we focus on in here.
It's a point in time, you
It's a
know,
point in time.
we talk about point in time all the
Yeah.
time for looking at information, and this is one of those changes will happen.
Yeah.
Going forward, no question.
I mean, we have another session starting in January if folks want to wait and see what has happened in the interim. And sort of like update this, I'm okay with that too. It's really, I'm fine. But I just think there's some it seems to me like some dire decisions being made that will have far-reaching impacts, and that's kind of what we do in this committee, so. But I'm happy to wait to that.
Well, it's what the committee would like to do. I personally like to move it forward and get it going, but if you want to, we'll listen to it. Okay, so can I go back to my question? With the changes that we just made, would the committee like to, send it out as a committee proposal? Can we do that?
no, I mean, at this point.
We can't do that. We can just vote for it. Yeah,
It
we
would be
can't.
as, you're gonna have a strike all amendment from the committee,
Right, we could do that.
or amendment.
Yeah, we can strike
But
all.
yes, it's been referred to your committee like a bill, so now your options are voted out favorably with amendment. Not take action.
I said this morning, that I would be happy to wait. And if that's possible, yeah, that's what I would like to do. Because I definitely think that there is a version that can gain significant bipartisan support on the floor, because health is not a partisan thing and should not be a partisan thing. And I think we can make this a version.
I'm trying to figure out how this is a partisan issue.
That's what I'm saying. It
Well,
shouldn't be.
My question, Senator, is how is this a partisan proposal? What is it to you that
One of
makes
the
it?
biggest things to me is the last whereas. I think it takes a very strong stance against the Secretary of Human Services. And I don't even know if there is a majority of our chamber that wants to make a statement that is very strong against a particular individual or a particular agency. I understand that people don't like the actions that the new Secretary of U.S. Department of Health and Human Services has made. And if I had to look at a whole list of them, I probably wouldn't agree with all of them either. But I don't think that there's a majority of the entire chamber that would agree in making just such a strong statement, regardless of how they feel about those decisions.
Okay, well, I think you can say that, but he does disregard science and scientific research.
Yes,
So, and it
But-
doesn't matter what the rest of the chamber thinks. It's what we think and hear from our perspective in health and welfare. So I understand that you're thinking about the political consequences of having a different vote. This is about what we see as realistic. And for me, the disregard of autism research, the disregard for vaccine research, the disregard for having scientific research of any type
Mhm.
through the NIH and canceling those grants is significant. So, I mean, you can argue it till the cows come home.
so
So,
I'm not talking about any political, what you say, consequences. That's not what I'm talking about. I'm
I
saying that if
understand.
we, as a policy committee, want to support the policy that's in this resolution, sending a resolution to the floor that we have concern that it might not pass the floor, I think would kind of make hard policy decisions as a committee.
I have no concerns that this will pass the
Okay.
floor.
Okay.
So my question is, do you want to act on it now? Or do you want to not act on it? Do you want to act on it now as it's been modified, or do you want to hold off and wait until January when everything else is happening? This is,
I mean, I can't speak for you. I'm happy to,
you can do either one.
Yeah,
I hear you. So, Larry, are you, Senator Hart, any thoughts? I know you did have thoughts earlier and then we.
I did have
appreciate-
thoughts earlier.
Yeah.
Yeah. Yeah, I personally would like to table it, but that's my deal.
and I couldn't find any evidence that Great Britain's pulled out of the,
Yeah, they did the I read the article. They were the first country to pull up.
I don't think so.
Please don't.
I won't.
Okay. Was this fact checked? Or went through?
Yes, I
Okay.
researched and
Seriously, not trying to offend you.
It's a lot.
Okay.
yes, they are all.
Okay.
I hope that autism runs fact checks. You voted on that.
I'm sure, yes.
I know, Michael.
Well, I also have a.
No, but
I'm also
I
familiar-
personally
I
reviewed,
worked about this, so
I work with all of it, so you have to understand that as well. So you're not the only person here who has knowledge.
I didn't say that thought that.
Good. Okay, so is there a vote on this? Who would like to send it out? Can send it out, we cannot send it out. Senator Gulick, you're the one that thought it.
I know,
Oh,
it's
your fault. We'll see.
let's send it up, let's do it, I mean, it sounds like committee resolutions are rare.
so this isn't a committee, it's already been
No, it's
introduced.
not a committee. room.
So-
So it's just been referred to you like
Right.
the autism one was.
Yeah,
And if we think it's a good idea to set it up or not.
would you like me to try to get signatures? That's the other thing. I can get
No,
signatures.
too late.
It's too late for
It's too
signature.
late.
Already been
Once a bill is introduced, it's introduced.
Yeah.
It's all over.
So it is referred, it's like it was on the wall and you're taking it off the
Yeah.
wall. Except that all happened,
Yeah,
so.
it's just that it's a resolution and not a bill. It has.
Right, but it's being treated as a bill under your Senate rules.
Disregards the existence of health inequities. Can you talk a little bit about that?
That's what health disparities, that's what,
Yeah, refusing to award grant funds to universities, which I disagree with. The DEI should not necessitate who gets grant. who
Right,
doesn't get
right,
grant.
right.
I was asking, how that disregards the existence of health inequalities, like, are those grants being used to research health inequality, or how does that have
yes,
to do with
that's what,
DEI?
what some of the equity aspect of the diversity, equity and equity
Okay.
piece is looking at.
Okay,
Disparities and inequities in distribution of healthcare services and receipt of and diagnoses.
well, I think I have one more word, and then I think I'm fine.
What we're,
After disregards, just with word certain. Or some or certain.
Where are you?
Certain.
Where are you?
after disregards, and then say certain science and scientific research. And we certainly,
I'm sorry, where? are we?
on the last whereas. That it appears the secretary, and then it says disregards science rather than disregard science, say disregards certain science and scientific research. And that actually is probably more accurate.
And Jen.
That's what you were talking about?
I'm using the word certain as a synonym for some or an amount of, and not as in like certain, it's certain,
more specific.
using that.
Yeah.
regard.
Okay.
Madam Chair. I gotta call my garage and let them leave keys to my car out.
Okay,
So I gotta call them and let them know so they don't forget to leave my keys out.
oh, okay,
So I get my car tomorrow morning.
Yeah. so it disregards certain signs that. He certainly doesn't disregard the dye bill. that we're gonna take up.
No, and he seems concerned with.
And he doesn't disregard the pollution that we were working on in Lake Champlain or the Hudson River.
Okay.
Yeah. Okay, anything else?
I think that is fine. Um. Anybody, not me necessarily, but if anybody has any amendments, are you able to have us look over those as committee?
I've never seen an amendment.
You
on a
don't usually
resolution.
get, you don't get amendments on resolutions. This is it's not a bill. It's simply a statement. In place to make, a point. Okay, so can we get a clean copy of this, Jen?
I'm working on it.
And then
Draft it as-
look at the clean copy and, so, vote on it.
Jen, from your impartial position, do you think that the cuts with vaccination will have a negative impact in Vermont?
My daughter's car.
Yes,
We gave her a car from.
you know the cuts that they
Graduation.
made there. I don't know the cuts. that
I
they
just
made
know
there.
that they cut staff. So I,
Okay,
so it seems likely that that will be, that there will be
do we know what the staff,
implications.
like, was it research or was it like,
Well, they cut management,
Category.
the management and regulation divisions at the Center for Tobacco Products in the FDA, and most of the staff at the Office of Smoking and Health at the CDC. So I think the CDC is likely research. I think the FDA is likely regulation of products and marketing of products, right?
do we want to say may have a negative impact or
No,
is
The
have
tobacco
a strong
companies
likelihood
we will not say may for that.
They are-
They
like
are,
vampires?
they are,
compared to-
yeah, they are prepared to amp up all of their.
Considering the strength of the cigarette lobby
Yeah.
companies, I would agree.
Yeah,
The probably the point there.
Yeah.
And they'll probably be focused on suing the crap out of somebody too.
Well, they're certainly not gonna say anything about menthol going forward. They're not doing anything about the flavors
That's all
in the way
needs to
that
go
they
away.
do it.
That's yucky stuff.
Ridiculous.
That's why I don't see. Don't chew tobacco, don't smoke, don't do that and stuff.
Okay. So. Okay, so. Jen, can we make these changes and then print it out and we'll see, and we'll do a little vote? Do you need a minute? Do you wanna go off live for a minute or?
Yeah,